Do positive lymph nodes always mean colorectal cancer recurrence? Imagine finding cancer cells in nearby lymph nodes after surgery for colorectal cancer. It's a sign that the disease has spread beyond the original tumor, which often raises concerns about the chance of the cancer coming back. But does having positive lymph nodes always mean the cancer will recur? Not necessarily. When doctors examine lymph nodes, they look for cancer cells that have traveled from the primary tumor. If they find cancer in the lymph nodes, this is called node-positive disease and usually indicates a more advanced stage of cancer. In colorectal cancer, this often means stage 3. Generally, the presence of positive lymph nodes suggests a higher risk of recurrence compared to cases where no cancer is found in the lymph nodes. However, it does not guarantee that the cancer will return. One key factor that helps predict the risk of recurrence is the lymph node ratio. This is the number of positive lymph nodes divided by the total number of lymph nodes removed during surgery. A higher ratio means more lymph nodes are affected relative to what was examined, which can indicate a greater chance of recurrence. For example, studies have shown that a lymph node ratio above about 0.38 is associated with a significantly higher risk of cancer coming back in patients with stage 3 disease. This means that not just the presence of positive nodes matters, but how many are involved compared to the total examined. The actual number of positive lymph nodes also plays a role. More positive nodes generally suggest a higher risk, but this is less important than the ratio. The total number of lymph nodes examined during surgery is also crucial because examining more nodes can lead to more accurate staging and prognosis. Other factors influence recurrence risk too. Features of the primary tumor, like how aggressive it looks under the microscope, such as tumor budding or poorly differentiated cells, can increase the likelihood of spread and recurrence. Blood markers like carcinoembryonic antigen levels, the depth of tumor invasion, and whether cancer has invaded blood vessels also matter. Treatment is another big piece of the puzzle. Proper surgical removal of lymph nodes and the use of additional therapies like chemotherapy or chemoradiotherapy can lower the chance of recurrence, even if lymph nodes are positive. In summary, positive lymph nodes do indicate a higher chance of colorectal cancer coming back, but they do not mean it will definitely happen. The risk depends on how many lymph nodes are involved, the biology of the tumor, and the treatments used. It's important to remember that each patient's situation is unique. A thorough pathological assessment and personalized treatment plan are essential to give the best possible outcome. Always consult with healthcare professionals for guidance tailored to your specific case.